The case I'm going to narrate to you today convince you that progressive treatment for fertility is necessary and not a very static treatment. What I mean by static treatment is repeatedly taking the same treatment again and again. So this couple was consulting for about 2 years for infertility, and at their place they were just offered letrozole cycles again and again and again. She would have irregular cycles, so they would just offer letrozole. If she doesn't conceive, they will give a gap. In the gap, they would get some OC pills and again letrozole cycles. And this story just continued for 2 years. After 2 years, they happened to see me for the first time. And when I looked in the papers, I said, well, 2 years have gone. Just done one hysterosalpingography, multiple follicular studies, and the same treatment taken again and again. And what is ultimately a success of a letrozole story? A letrozole cycle, if you have a proper ovulation induction and if you have intercourse, the success would be anything around 10 to 12%. Imagine this couple is taking a success of 10 to 12% months after months for a period of 1 to 2 years. A progressive treatment is necessary. And I looked at her anti-Mullerian hormone level 2 years back. The anti-Mullerian hormone was 3.2. I said, well, let's repeat the investigation. I want to know your anti-Mullerian hormone again and do your FSH-LH again and look at your antral follicle count. At a transvaginal scan, I was not convinced about the antral follicle count. I thought it's pretty less, and surprisingly, the anti-Mullerian hormone came just 1.12. So within 2 years, from 3.2 AMH level, she had dropped to 1.12. Given a lady of unexplained infertility, we really don't know what is the trajectory of fall of an anti-Mullerian hormone or trajectory of fall of an ovarian reserve of a particular lady. So it is mandatory that at least yearly a repetition of anti-Mullerian hormone and ovarian reserve should be done so that we reassess the whole thing. I said, with your ovarian reserve coming down, it is better we expedite the treatment rather than going with a smaller therapies. Let's use gonadotropins or IUIs or maybe IVF, which is needed. And they were pretty convinced. But I think it's too late. Why waste 2 years of precious eggs? Every month, about 1,000 eggs start forming and only one matures. So imagine every month you're losing 1,000 eggs. Isn't that a vital loss? I think it's better to take progressive treatment. If you go with 2 or 3 cycles, if that treatment is not successful, better to step one step forward or look and modify your factors and then go ahead with treatment rather than repeatedly taking the same treatment again and again. Thank you.